open mine.
Oh yeah, it's not Christmas yet. Gotta wait till gotta wait till Christmas, okay, honey? Now put it.
No, it's not mine. Jill, fly it.
Let's put it back.
Jill, fly it.
Do you know how to read your name? Right here. Look, your name's on the box.
Well, that's not mine. That's not mine, Mommy. That was mine.
That one's why do you think that one's yours?
Because it is mine. That was fly it, but it was mine.
Oh, because it's bigger?
Yeah, big for me. But that was fly it. I don't thirsty.
Hi everyone, welcome back to our channel. Welcome back to VLOGmas episode 3, I believe. If you're new here, hi, I'm Dr. Jenny Lay. I'm a family medicine physician and a mom of 2. And so today I'm going to talk to you guys all about family medicine and why I specifically love it so much, why I try to convince more people to even consider this subspecialty. But not only that, I'll give you all like the pros and cons that can possibly think about. So what I love about family medicine is that you really get to tailor your practice however you want. You are what you attract is what I should say. So if you love seeing kids, if you tend to gravitate more towards a younger patient panel, then those are the patients that you will attract to come to you. I generally find that your age has to do a lot with the types of patients that you see. So I tend to attract more young females in their 20s to 40s, and they tend to come to me because they feel more comfortable with me. I personally love to do procedures, and so anytime that I do a procedure and I do it well, my patients tell their family and friends, and then also other doctors hear that I do procedures, and so they send their patients to me to get that done. As you guys know, healthcare is very strained right now. Specialists are getting referrals all the time, either for behavioral health or like to dermatology, just to get a biopsy and things like that. So if I, as their primary care doctor, can help them with those things, decrease their wait times to get things diagnosed, then I do my best to do that. So things that I do here in the clinic, I do all sorts of joint injections from like the wrists to the elbows to the knees to the shoulders. I do all the different gyne procedures like pap smears, IUDs, Nexplanon, colposcopies. I do lots of types of skin biopsies, so shave biopsy, punch biopsy, and even excisional biopsies. I do lots of OMT, so when people have muscular strain or when they are in car accidents or they have anxiety or headaches, they come to me, and then I do manipulation to help them with that, to try to decrease the need for medications. And then when that doesn't work, like for my older patients, I can do like injections of either lidocaine or just a steroid directly into the muscle to help with spasms. So as a family medicine doctor, I feel like I do so many different things, and because I have a little bit of ADHD, it's really hard for me to concentrate on one topic at a time. So I tend to jump around a lot, which is very stimulating to the mind. The breadth of family medicine is so vast that you will never get bored and you're constantly learning. And so I love that about family medicine. All right, I have to go eat my lunch now. But I'll be right back. The other thing that I love about family medicine is just like the continuity of care that you get. Like my patients, I know so much about them, about their families, their goals, their passions in life, and I feel like that's what makes you a good doctor. At the same time, you're just like, oh, I feel like so much love, and it's amazing to be able to take care of a baby growing up to be a teenager, and then them being parents and growing into old age. So you definitely see like all variety of patients and people, and you become part of their family, and that's what I really love and enjoy. This is another smoothie for my lunch because we didn't have any food. I also have another protein bar. This one's cookies and cream. I made pumpkin seeds from Halloween. Some things that I don't like about family medicine is the amount of paperwork. we have to do. When you see a patient and you talk to them about something, like say your anxiety and depression, you have to talk about, I have to document everything, like all the stuff that's happened in your past that led you up to this, or like your family history, your surgical history, all the medications that you've tried, the possible side effects that has occurred with those medications, why I think it's a specific diagnosis and not another specific diagnosis. Basically my whole thought process, like that goes into a note. If the note is not done, then I don't get paid. Some institutions won't pay you if the note is not done within like 48 hours or something like that. And then there's also lots of patient messages and medication refills and just documentation that I have to review. There's prior authorizations where you have to deal with insurance companies where you say, this patient needs an MRI. And then the insurance companies like, do they really need an MRI? We need a prior authorization. And they call you and then they say it's not covered. It's very difficult dealing with institutions that don't really put patients' health first. They think of profits first, and that's not how we think as doctors. And so it gives us a headache. Like just talking about it gives me a headache. So it is 5:30 and I am all done seeing all my patients. Lots of procedures today. And I finished all my notes already. And so that's pretty good, I would say. Patients are scheduled for me from 9 to 4:30. And so I would say my schedule specifically is pretty good. I mean, I'm choosing to work part-time, and so my schedule is only 2.5 days a week. So I feel like with family medicine, you have so many different options. You can work part-time, you can work full-time, you can work at urgent care or the emergency department, or you can work in the hospital, or you can just do palliative care. You can just do private practice, you can do aesthetics. You can obviously do a fellowship if you wanted to do like high-risk OB and things like that. So I've done lots of videos talking about that stuff. But yeah, that's another reason why family medicine is awesome. Mommy's here!
Mommy?
Wow, yummy.
I'm guessing they don't have any cookies.
Oh yeah, no cookies today.
Why home? That's silly.
Wyatt's home?
Although I made a mess.
Oh, you made a mess? Where?
There.
Good job, Wyatt. Good bite.
Why? Washing.
Daddy made it good, huh?
I made a lot.
Good job, guys.
And also what I did.
Good
I
job.
just ate a lot of bites.
Oh, yeah.
Good job, honey. Wow, you guys are such good eaters. I am so impressed.
No. I got to see.
Okay, that's enough.
My want one.
Mommy's okay, honey.
Daddy, my want ice cream. Mommy, you eat mine.
Aww. Thank you. Mommy's full. You can eat it for now.
Just on here, on the ice cream. I don't like it. I like it on the ice cream.
Outside's chocolate. Try to take a bite.
No, I want to Vegas. And what's this in here?
Vanilla ice cream.
Let me try. Mine is chocolate. It's yummy, and know what's inside. And I don't to be a big one. And mommy, you share with me. And now I'm not who eat the mom.
No, don't eat down there. Eat the top.
Eat the top first.
Eat the top.
This is ice right here. This part.
No, no.
Eat the top.
Haha. There you go.
Thank you. I way home.
Is that better?
Daddy, my chocolate. You're silly. That's silly, Mommy.
Yeah, that is silly.
I can't.
Oh, you're humming?
Yeah. That is bad.
Why?
For that is bad.
Why?
For that is bad.
Oh, I don't think it's bad.
And maybe it's bad. That's a little bad.
Oh, just a little bad?
Yeah, that's a little bad.
Oh, I don't think so.
Yes, it is.
All right, so I don't think I could make a complete pros and cons list without talking about the salary of a family medicine physician. As you guys know, this is how much I get paid. As compared to this is how much school loans I have. You know, compared to other specialists here in the United States, it's the lower end, right? Is it low in the terms of overall in general? No, it's actually a lot of money. But as comparison to how much school loans that I have, the amount of work that I'm putting in, I feel that doctors, specifically primary care physicians, are not compensated for the work and effort that they put into taking care of their patients in general. The United States has a very backwards healthcare system where they idolize specialists, and so they get paid the most money. But we know that preventative medicine and the root of health lies within primary care. I don't know. I feel valued within my own institution, but overall, in general, I don't know how it is in other places. And also remember that I work in Washington State, so this is my salary here. As compared to California, I would get paid significantly less, closer to like $90,000 if I wanted to work part-time. Now, if you want to talk about like respect as a family medicine physician, I feel like a lot of med students ask me this, like, oh, do I get discriminated against, like, because I'm a family medicine physician, or do people look down upon me and all that stuff? And the answer is no. If you are a good doctor, if you follow science-based medicine, you're up on the most recent research, you care for your patients, you do thorough workup before referring to the specialist, they will all love you and appreciate you, not only the specialists, but your patients. And so I would say that be a good physician, and no matter what subspecialty you're in, you will be respected. There's probably more discrimination towards my race and the fact that I'm a small Asian female providing care for like an older population or something like that. I will tend to get more discrimination because of that, not because I'm a DO, not because I'm a family medicine provider. I think I'm gonna end the video here. Thank you guys all so much for watching. If you haven't already, please subscribe, join the family. Let me know what you guys want to see for Vlogmas, any questions you want me to answer, and I'll see you guys again next time. Peace.
I don't eat on the party. I don't eat this toe thingy. First, I don't want to eat that toe thingy.
Okay.
First, I don't eat down the bottom.
Oh, okay.